Good morning, good afternoon and good evening. I am Emma Joyce, Head of Community at Global Digital Finance, and it's my pleasure to welcome you to the Global Leaders Town Hall in partnership with the Global Blockchain Business Council with special guest Dr. Jemilah Mahmood today. TAN3 Dr. Jemilah Mahmood is a special advisor of the Prime Minister of Malaysia on public health and has been since April 2020. She is a renowned humanitarian, well known for her role as founder of the medical NGO Mercy Malaysia in 1999. She recently returned to Malaysia, having been the Under-Secretary General for Partnerships at the International Federation of Red Cross and Red Crescent Societies since January 2016. Dr. Mahmood was the Chief of the World Humanitarian Summit Secretariat at the United Nations in New York, and her previous appointments include Chief of the Humanitarian Response Branch at UNFPA, Senior Fellow at Khazanah Nasional Berhad in Malaysia's Khazanah Research and Investment Strategy Division, and Senior Visiting Research Fellow at the Humanitarian Futures Programme at King's College in London. From 2006 to 2009, she was one of 16 members appointed by the United Nations Secretary-General to the advisory group of the Central Emergency Response Fund. Her vast experience has encompassed healthcare in crisis and non-crisis situations, emergency coordination, partnership and resource development, strategy, policy, knowledge, innovation, as well as strategic communications. Dr. Mahmood has held many board positions in NGOs and INGOs and is a recipient of numerous national and international awards for her contribution to civil society and work in support of marginalised communities, including the first ISA Award for Services to Humanity from the Kingdom of Bahrain and the Merdeka Award from Malaysia. She was recently awarded the ASEAN Prize in 2019. She was recently Civil Society Governor of the Commonwealth Foundation until January 2020 and is a board member of the Global Responsible Finance Institute. She has also been an active member of the United Nations Disaster Assessment and Coordination Team since 2004, leading many missions including to Pakistan and Myanmar. Dr. Mahmood has also received royal awards from the Federal Government of Malaysia. Her appointments in the Government of Malaysia include being on the previous Health Advisory Council to the Minister of Health and more recently as a member of the Economic Action Council. She graduated as a Doctor of Medicine from the National University of Malaysia, has 2 postgraduate degrees including Fellow of the Royal College of Obstetricians and Gynecologists, United Kingdom, and a Master's in Obstetrics and Gynecology. She also completed executive education at the International Management and Development Centre, IMD, Lausanne. Abdul Haseeb Basit, board member and treasurer at GDF, is hosting today's town hall, which is focused on Dr. Mahmood's experience in tackling global health problems and the role of finance in mobilizing a response. Abdul is also a co-founder and principal of Ellipsis, a research advisory and venture builder, chairman of Yielders, a crowdfunding property investment platform, and the first regulated Islamic fintech in the UK. Previously, Abdul was CFO of Innovate Finance, the UK not-for-profit fintech members association, and also worked in Tier 1 banks in technology transformation and strategy with a private wealth and asset management focus. We welcome and encourage your questions today. If you have a question, please feel free to submit it at any time using the questions box located at the bottom left of your screen. I hope you enjoy today's session, and I'd now like to welcome Abdul and Dr. Mahmood.
Thank you very much for that kind introduction, Emma. Good morning, good afternoon, good evening to all those listening to the webinar today. Thank you for joining us. I encourage you to submit your questions, which we'll make time to answer towards the end of the webinar. Today, I'm delighted to welcome Dr. Jemilah Mahmood at what is undoubtedly a busy time for you in your new role as Special Advisor to the Prime Minister of Malaysia on public health during a pandemic. Welcome, Dr. Mahmood.
Thank you very much, Basit, and it's the evening here, so good morning, good afternoon, and good evening, everyone. It's a pleasure to be here.
Now, Dr. Jemilah, you've had a distinguished career which spans over 25 years in which you've worked globally to lead responses to all manner of crises, medical crises such as pandemics, refugee crises, natural disasters, including tsunamis, droughts, and famines. In your view, how does the current crisis, COVID-19, compare, and what's unique about this crisis in relation to the crises you've managed through in the past?
Well, first of all, every crisis is different, whether it's a disaster arising from a natural hazard or a conflict or a health-related crisis. But in all manners, the approach to crisis management remains the same. In the pandemic, which is the COVID-19 pandemic, one of the biggest challenges we face is that it is spreading very, very rapidly. And we are seeing extremes of either very mild disease in a large proportion of people to very, very aggressive effects on pulmonary pathology with the lungs and also other organs. And because of the speed of passing the disease from one to another, the virus being so contagious, one of the biggest problems we face with this pandemic is that it really is affecting, densely populated areas, urban settings mainly, and also because it's a novel coronavirus, so it's never been around before, it's new, there are no antibodies, so there's no vaccine. So this all creates, all the added complications of managing the pandemic.
And in your experience of tackling global health problems at the Federation and developing best practice, what are some of the common challenges and some of the failures that occur in response to a crisis of this nature?
Well, first of all, when you have a pandemic of this nature, the reflex action is that we have to, it's a health and a medical issue. Yes, it is. But when it becomes a medical problem to deal with, a clinical problem to deal with, it means that we have to focus on other things that can prevent it from getting there. So in pandemics, one of the most important things to remember is that it really is a disease that has to be tackled at the community level. So it's about good risk communication that is early. It is about engaging with communities, building trust, because they play a major role in preventing the spread of disease. So where there are good measures put in to engage with those communities and for them to take ownership of their own local communities to be able to prevent further spread by simple action. You've heard about the whole physical distancing or social distancing, washing your hands, good, respiratory hygiene, then, that really can cut down the transmission of the virus. And then, of course, is, where it is good practice is when good health systems exist. One of the things we have learned as a global community is from previous viral epidemics or pandemics is that you have to be able to set up very quickly hospitals and health facilities that only deal with COVID and not mix them with other disciplines. Then you can have dedicated centers that can be isolated, where the disease can be contained. And I think we have seen in this pandemic where there are such systems, and I can say, for example, in Malaysia as well, that we are able to quite quickly flatten the curve. We see that when people don't do that, then you have a wider dissemination. This happened in some cities in Italy. One of the other things that is very interesting in the pandemic is that with the advent of technology, which is more sophisticated now, leveraging technology will allow you to actually detect, contact trace, and then follow people around their movements, their contact with other people. So therefore, early detection is possible. And I think in the past, many years ago, we didn't have a situation in the pandemic where technology could play such a critical role.
And so we have a slide which we can bring up, which sort of demonstrates some of the current data around COVID-19 worldwide, and we've highlighted a few countries here which have taken different approaches to their handling of the pandemic to date. In your assessment of the global response, what's been some of the best practice examples that you've seen? Where have people taken on the learnings, some of the learnings that you've talked about, and where have really the responses fallen inadequately short of what are appropriate levels of response to something like this?
I think probably the best performing, country would be, I would say, Korea, South Korea. One of the advantages of South Korea is, number one, they had a lot of learning from the previous, coronavirus viral infections, and they have really been able to invest a lot in research and development. They could detect, they could create a test kit very quickly and scale up production. This is a country that has the infrastructure and digital penetration, where people are very savvy. They understand the use of, the web and the smartphones and so forth. So it was very easy for them to institute a system where people would be tested, people would have their information, their geolocations all on an app. It was easy to monitor, and there's a real discipline among the people as well to comply with the good practices in managing pandemics. And the interesting thing about South Korea is South Korea never went into a lockdown because they were very confident they could trace their patients, they could trace the contacts very, very quickly. And they were able, they had a spike, but the spike came down very, very early. No doubt, with coronavirus infections, you can never eliminate it completely unless you have a vaccine or you have enough herd immunity. But with South Korea, you're seeing a little bit of a small spike coming up, but the health systems are able to cope, and I think this is important. On the other hand, when countries, first of all, are late in acknowledging that the coronavirus or the COVID-19 virus is a risk to the population, and therefore don't institute the measures, don't do enough testing for the population, that's when they start seeing the large numbers of cases.
And so you've been in your role advising the Prime Minister of Malaysia on public health for almost a month now. What are the factors in Malaysia's response to COVID-19 that you've been most pleased with so far?
Well, first of all, I think Malaysia is very lucky to have a very strong health system and enough health expertise, and who have actually previously managed other outbreaks as well, the MERS, the SARS, and so forth. So very quickly, the health ministry set up the systems, as I was saying, dedicated COVID hospitals, personnel who had been trained, and then started to ramp up the testing. I think this has allowed us now to flatten the curve, and I would say that we are in the recovery phase now. Added to that, there was a very early decision to have a movement control order that would reduce the spread of the virus and so forth. One of the interesting things about the Malaysian context is the origin of the virus has come from different sources, right? People who have traveled from China, from Europe, from Iran, and so forth. So it's very different, and we are discovering now that they also come with different strains of the coronavirus. It's interesting that the A, B, and C. And we had one cohort, which was a gathering, a religious gathering, that accounts now for 40% of the cases that we are experiencing. So because we could understand and detect that cohort very quickly, we were able to ramp up the testing, on the patients themselves, on the first contacts, and now it's gone to 5 generations. But we managed now to kind of taper down the disease, and beyond the 3rd generation, it's not spreading, which is good. So that's on the health side, which is good. The other thing, of course, is that we have really ramped up building the technology for Malaysians to have on their phones, so that as we go into recovery and start opening up, there's ways for us to ensure that we can detect movements of people, and if there's a need to do a small clampdown or an isolated clampdown, we know where that will be.
Interesting. And we hear, you touched on it at the beginning, and we hear much about vulnerable groups being disproportionately affected by this pandemic. Can you give us the medical rationale for why these groups, whether they're elderly, those with underlying health conditions, or those from poorer socioeconomic backgrounds, why are they more disproportionately affected, across the globe?
Yeah. I think with any infection, particularly a viral infection, your immunity to start with is going to be very critical. When you are vulnerable in the sense that you may be from a lower socioeconomic group, you may have a little bit of, malnourishment, or if you have other comorbidities like high blood pressure, diabetes, autoimmune disease, automatically your immune system is down. Now, one of the terrifying things about COVID is that when it's in its aggressive form, and you think it's just the lungs that is affected, you get this terrible respiratory syndrome. But it also, one of the side effects, or one of the effects of the coronavirus is the cytokine storm, where your body goes into overdrive and you start forming clots into your system, clogging everything, clogging your kidneys, and then you go into multi-organ failure. And if you already have diabetes or hypertension, chances are your organs themselves are not, in the best of health. So this is why there's an increased risk to people, particularly the elderly, people with comorbidities.
So we as a technology and a finance community are inherently data-driven, and when we look at figures like this, it's very hard to sort of draw parallels between different countries because of the various rates of measurement and reporting. And obviously, acute management of the peak of a crisis is a natural area of focus, but managing the overall complexity of a pandemic is not as straightforward. In your experience, what are some of the other factors that have to be managed at a time like this, beyond the reporting of the cases and the numbers that we're seeing at the moment?
Yeah. Well, first of all, I want to talk about the numbers a little bit. We have to look at, when we look at the numbers, it's also very good to look at the differentiation of, what are the types of patients that we're seeing with coronavirus. As we mentioned before, the vulnerabilities and so forth. The other thing is around testing, right? Because the more you test, the more you will detect. So how much do you test? How little do you test? When is testing enough? So one of the good things is WHO has come up with some very clear guidelines. And they're saying that if in 10 tests that you do, or 100 tests that you do, you get 10 who are positive, then it means that you're testing enough. If you're testing and then you're getting, say, 20 that are positive, it means you're not testing enough. So it's about the positivity rate of your testing, which is very, very critical as well, not just the number of tests, but also how many % of your tests come back as positive. So if it's 10 or less than 10, there's a good indication that chances are you're testing enough. So that's one thing. So I think that, numbers also have to correlate with the testing. Perhaps, there may be countries that are not showing high numbers because probably they're not testing, and they are having mortality that they may attribute to pneumonia or any other infection, but without being able to test, it's quite difficult. I can give you a couple of anecdotal sort of cases in Malaysia where, some patients come in almost like typical myocardial infarction or heart attack, and they die. And you would not suspect that they had a COVID infection, but all of these deaths, they were swabbed, right, even postmortem swabs, and they have come back as positive. So we have to be very careful that, you don't just attribute deaths and morbidity to a non-COVID without adequate testing. So that's on the numbers. I think the other thing that we have to think about is on the data itself. What is really interesting now, what we're finding is that when you look at data, where is the spread of the cases, right? And is it an urban, rural? Is there, how is travel, for example? We're finding that, people coming into the country through our borders, these people have have a risk of bringing the disease as well because of the very nature of the virus, not because of not wanting people to come in. So again, how are your border controls and testing as well? How do you then know the numbers, for example, if borders are porous? So you have to consider all these things when you look at data.
Now, we first came to know each other through the Responsible Finance and Investment Foundation, where you're a trustee, and much of the work you've done in recent years, especially at the Federation, has been about driving partnerships, specifically private sector and finance partnerships, into the humanitarian space. On the next few slides, we've got some brief case studies about some of the projects you've been involved in. I wonder if you could touch on a few of these, and specifically the role of digital finance, what the role of digital finance is in firstly mobilizing a response to a crisis, and what impact it can achieve during the crisis and beyond, whether that's through providing payment mechanisms, identity to undocumented refugees, or through other means.
So one of the things that, keeps me awake at night sometimes is that, when we think about settings where you don't have soap and you don't have water to wash your hands, you don't have the basic sort of health facilities, the risk of you, dying from a disease like COVID is probably higher. And, COVID comes at a time where, there has been so much disruptions in global disruptions, our environment, the way, the whole globalization, right? You become very global, and disease spread also can be very global. So one of the areas we've been looking at is this concept of one wash, that you cannot have good health without adequate water sanitation facilities. And we looked at the disease, not a pandemic disease, but something that has been with us for a long time, and that is cholera. So we know, for example, that there are only a number of countries that have cholera, that's endemic for cholera. So theoretically, if you can eliminate cholera in endemic countries, you could eliminate or limit the number of cholera cases or outbreaks or cases that you have. And you cannot do this as a health perspective alone, or vaccination and so forth. It has to be about behavioral change, ensuring that people have access to clean water, people have access to sanitation facilities. So, diseases like cholera, diseases like pandemics, like COVID-19, is really one that is a result of a disruption in economic, environmental situations, and the humanitarian issue being a lack of access to water and sanitation.
And so in the One Wash Tikuk, you've obviously brought together a number of various stakeholders. I wonder if you could talk about some of the innovative approaches you've taken in trying to bring these various stakeholders together around a collective mission.
Yes, one of the things we know in the humanitarian sector is the needs are great and the funding is not as much. Right? Every year there's a humanitarian appeal, and every year we have a gap that's widening. 20% of the people are funded, 30%, but we're talking about hundreds of millions of dollars. And similarly, with diseases like cholera or lack of water sanitation facilities, we felt that this is so fundamental to the Sustainable Development Goals as well, that we have to look at a new way of mobilizing capital. When we look at SDGs itself, the talk is that we need 3 trillion a year to be able to achieve, to be able to have some way to achieve our SDGs. But we know that it's so hard to mobilize 3 trillion from overseas development assistance because the ODA is a fraction of the financial flows in the humanitarian and development world. But what we do know is that the market is about 300 trillion available there. So if we can actually harness, private capital and bring that into a blended model with, donor capital, we can probably, take the work that we want to do to scale. So we partnered with Islamic Development Bank, and we decided that we would call it a One Wash. We established a One Wash fund at the Islamic Development Bank. And what we're trying to do is bring in the philanthropic capital. The philanthropic capital is always there. We've been doing water sanitation and hygiene for many, many years. We have already reached 35 million people even without this project. So we have our regular donors that will put in capital anyway for us to be able to do this. But what we thought is that we will try to be a bit innovative and also look at outcome buyers. If we can say to potential outcome buyers who could be philanthropies, who could be donors themselves, who could be other entities that want to purchase outcomes, right? Say, for example, you went to somebody like Bill Gates and said, I will reduce mortality as a result of cholera by 90% in the next 7 years. Therefore, if I achieve this, then, here's the cost. And then at the same time, you launch a sukuk that will then mobilize capital. So what that does is, first of all, be able to allow you to take things to scale. But secondly, there's a distributed risk, right? The philanthropists don't understand implementation risk. So you're talking now about financial risk, for the one-wash investors. For the philanthropists, if you don't achieve it, you don't pay. For the donors who put in money at the start, they understand implementation risk. So it's about getting the different parts of the puzzle, right? The components of who is going to be participating in this one-wash fund to be able to then take this to scale. So this is quite innovative. It's not been done in this sector, in the water sanitation sector. So we are still struggling a little bit, especially now with COVID, to ensure that we have enough capital in the fund for us to be able to launch the sukuk, and also we are looking very seriously for the outcome buyers as well.
I just have to comment. A couple of years ago, having done some work on social outcome type issuances, this is a really innovative model, and possibly the most innovative model that I've come across, that brings the various different risk appetites together under one instrument. And so I encourage anyone who's interested in this space to have a look. The source is at the bottom of the slide if you can read it. It's available on the IFRC website if you Google One Wash Sukuk. But as you mentioned, this is a project in process. We're still trying to raise the capital for this. You do have examples of where you have really been able to have tremendous impact just on the philanthropy side, and without even bringing the private capital in. So I wonder if you could talk about some of the charitable initiatives that you've set up in response to famine in Kenya and other such places.
Yeah. So this was a couple of years ago when there was a drought in Kenya, and there was a lot of issues with food security. So what we did was, partnering Kenya Red Cross, one of the members of our federation, and also mobilizing some capital, which is Islamic social capital from Malaysia. We actually started with this as a test, right, to just prove that Islamic social finance could be transformative and not going beyond charity. So what we did in this case was partnered with the meteorological officers of Kenya, plus implementing something that we call forecast-based action. So we were able to look at what the climate pattern would be like, when the rains will fall, and therefore predict with the agricultural department what crop might thrive. Now, this was an area in Kitui County that had about 1.2 million people. So working there, we decided to change the crop from corn to green gran. We rehabilitated wells to ensure that there was clean water. There's water flowing to the people as well as to the crop and to the livestock. But based on that, we had a very decent harvest, not the best harvest, but the rain was short, we had a harvest. And all the other people who were growing corn outside this project, they had failed crop. Now, what then happened was, partnering with the local government, we said, okay, now we have wells, we have water, this crop can go on. We had a contract with the people to say that, half of what we spent on you, on the seeds, would you give it back into another fund so that we can recirculate that. So we then spoke to the local governor to say that don't force sell the crop because it's going to drop the prices. Therefore, can you create some kind of cooperative where you hold on to the crop? And then what happened was, to cut the long story short, the wells themselves generated income and employment for young people. The locals could collect water in jerry cans and sell them for a profit and put their children to school. So we were able to plant in 245,000 acres 175,000 plus families, but particularly looking at women as well, ensuring that even if they had a small plot, they could plant. Now, just on $1.2 million and about maybe 500,000 was spent in seed, we managed to harvest, I think, 20,000 metric tons of green gram. And with this cooperative model, we were able to then have yield, or rather a profit of $20 million. So it was quite incredible that a 1.2 million project actually yielded a 20 times return. That money was plowed back to the communities. They decided that the payback of the 50% would go to another community. They used the money to set up health facilities and so on and so forth. So it's really about now the communities coming together to have a sustainable model of generating income and sustainability.
And so, just touching on that sustainability, say that you've delivered 20 million in total return for these families from crop sales, from just that 1 to 2 million initial contribution.
Yeah.
What sort of ongoing impact is that 20 million then going to have? And does it insulate this community from from further droughts and further need for charitable philanthropic contributions? Are they able to sustainably manage their own crops now? Is that been achieved?
Yes, I have actually tried to follow up on a regular basis, but now that I've left Federation, I have stopped. But the last when I spoke to them, that the community was still thriving, the wells were still running, they were generating income from alternative sources. They were able to now use this whole, this idea of forecast-based action, timing their crops, using the right crops. They were, as I mentioned, they were able to invest into health. They have health clinics now for their women and their children, and so it becomes a circular economy, if you like, that the communities can then find ways to sustain themselves. So that was the last when I spoke to them late last year, and this is about 2 years ago.
And so we've had a look at sort of finance innovation, the innovation around using philanthropy more effectively, as you described, to develop more of a circular economy. I wonder if you could touch on the role of technology and how some of the programs you've worked on where technology has been brought to bear on in times of crisis like this, and the impact that's had.
Yeah. So IFRC and its 192 national societies run massive cash programs all around the world. I think in 2000 and I think the data for 2018 is we then delivered almost $1 billion US of cash programming. Last year itself, and as ongoing now, we have the largest cash program in the world, 550 million euros in Turkey to provide cash as well as livelihood development for 1.7 million Syrian refugees. Now in Kenya, there was a very interesting project that was looking at piloting blockchain. Hang on a minute, I have this. Why there's an incoming call? Piloting blockchain use in the community using digital cash transfer. It was successful, but of course the money ran out, right? So, but what it showed us is that even in quite remote and rural communities, digital transfer and the use of blockchain had very positive results. What I understand now, and I have lessons, so I can't give you real details, that the community itself, just by the whole approach of data, the shared ledger, and choosing a different way of transacting, have now gone in and set up their own, almost like a community credit system, where people can then have credit, right, and by trading with each other commodities as well. So I don't have the full details. I will send it to you when I get the paper so that you can share it on. But it's very interesting how how versatile digital cash transfer can be. if I come back to COVID-19, one of the things that's happening here in Malaysia is that, in many of the communities, we have decided not to give them, goods because of the lockdown. People are not able, especially vulnerable people, are not able to buy things, right? So instead of just giving them rice and so forth, they're giving them cash, putting it into their bank accounts, and they're then able to do more online buying and so on and so forth. So I think this is going to, COVID-19 has been a big lesson for the country that, we really need to ensure that, our e-commerce, our digital transactions has to be, more widespread, right, available to everyone.
So bringing these examples back to COVID-19, for example, with the One More Sukuk, where it's multi-stakeholder environment, the Kitiri project, which is more about creating an onward circular economy, use technology, as you mentioned, in digital cash programs. What are some of the takeaways for you from the work of the Federation that can be applied to COVID-19 right now?
Oh, I think so many things. What is stopping Malaysia, for example, to establish some kind of social sukuk, for example, right? There's going to be serious repercussions after this. We know that, COVID-19, the universal impact of, the impact of COVID-19 on economy is going to be experienced globally. We are going to come out of this, with a real impact on our growth, and I'm sure that there will be impact on livelihoods as well. So I'm thinking out of top of my head, right? So maybe food security might be an issue. Could we, innovate and think about a blended model sukuk that can actually look at how we achieve or attain food security, maybe using some clear indicators like, childhood nutrition rates or stunting and other things which are long term that we can measure. So and similarly, there could be other areas. For example, how do we create affordable housing for the poor? So I think there are many. For me, I think there's so many ways that we can apply. Some of the lessons that we have learned from the humanitarian sector, and especially of late, looking at more innovative finance and how we can really apply them to the COVID situation as well.
So I just have one final question for you, Dr. Jemilah, before we move on to the audience questions. And I can see some of the audience questions coming in, and we've managed to weave some of those into the discussion already. But please, I encourage you to send more questions in, because we will have time to answer them. But from my point of view, the focus now in most countries is looking forward beyond the containment phase of this crisis to exit strategies. What are some of your expectations for what exits will look like? When may we expect to see some of these restrictions being lifted in practice? And what ongoing restrictions are we going to have to get used to and adjust to for the medium to long term as we move forward out of this crisis?
Okay, I think the exit strategy is not going to be the same for everyone, but what is going to be important is the guiding principles of when we actually can exit. Now, WHO has come up with 6 criteria on how we will consider an exit. So these criteria are very clear-cut. For example, looking at whether you have enough, have you flattened the curve, have you got enough health, is your health system able to cope in the event of another shock? Therefore, what are your reserves are? Have you been able to protect, for example, welfare institutions like, elderly retirees' homes, children centers and so forth? Are you able to ensure your borders are secure? Are you able to ensure that the community, are you able to institute a robust community engagement and understanding? So there's 6 factors. It's very clear cut. Go to the WHO website and you can actually look at it. So So for us in Malaysia, I give you the example of Malaysia, we've looked at different parameters, and it's very encouraging. What we're seeing is that we can almost tick off everything. But of course, timing is everything, and balancing health and economic recovery is going to be extremely important. You do it too early, you have a risk that you might have another flare-up. You do it too late, then you have a serious impact on the economy. So I think that finding that balance is going to be very critical. So it's not out of the blue you decide, okay, I think this is it. It's 3 months or 2 months we're going to open up. No, there are clear guiding criteria that WHO has shared that can really help you make those decisions.
And so moving to the audience questions, some of them are related and move quite nicely on from that last point. So one of the questions is that we're looking at vaccine as a way to stop the pandemic and to stop us from having these sort of social distancing measures. But in your experience, are flu vaccines ever really that successful? Can they really be? Can a vaccine really be prepared in as quick a time period and to an effective level that it can really help stop this virus from returning?
Well, I'm going to give you the bad news and the very bad news. The bad news is that for some strange reason, scientists are still trying to come to grips to figure out how this virus is behaving. But one of the things we are beginning to see is that antibody production after an infection is very, very low, which means the risk of reinfection is there, right? Whether it's high or low, it's that basically you have a risk. Because you're exposed to a virus, your body should be producing an immune response, and therefore you can measure the antibody levels, and therefore hopefully you don't get a reinfection. But what we're finding now in many patients who have recovered from COVID-19 is that their antibody levels are negligible or undetectable. So that's bad news. The very bad news is that until now, even for MERS and SARS, there's not been a vaccine developed. It's very difficult to develop an RNA virus vaccine. It's just very difficult. With one of the good things I would say is that there's a global collaboration. WHO has managed to get many different scientists from all over the world have now committed to work together so that the race to find a suitable vaccine hopefully will be accelerated. But even then, we don't expect to see one for at least the next year. So, if there is low herd immunity and there is the prospect of having a vaccine is only in a year or 18 months' time, then chances are, it will take time, and we have to get used to what is often called the new norm, that life is never going to be the same again, and life should not be the same again. I think we are in this situation now because, we have just, I think not protected the environment, and our lifestyles are being so unsustainable that has really led us down this track. So, social distancing is going to be a norm. Hand sanitizers are going to be a regular feature in a lady's handbag. The practice of safe respiratory hygiene has to be, something that we take very, very seriously. And the communities themselves will have to adjust to all this. If you live in a community like in Malaysia, where there's a lot of, cultural celebrations, and, we are in Ramadan now, right? And imagine no prayers in Mecca and no prayers in our mosque here. This is a huge change for many cultures. Church congregations can't get together on Sunday. So there's so many things that are, just challenging, our everyday routines. And I think this, should be something we all take time to reflect on how we want to live our lives, after this. But this is going to be a long, long time before we ever get back to what we might perceive as normal. And I think if we don't do it, if we don't protect this period of time, if we don't really adjust to what is called the new normal, I think we are in for trouble, because there's no prediction that I mean, there's no saying that you will not get another COVID virus or another coronavirus. As you may know that SARS and MERS are all part of the coronavirus family, right? So, they will happen again. It's not a matter of if, it's just when.
So you touched on something very interesting, getting used to this new normal. One of the things that we hear a lot about is an area of concern, a developing area of concern is mental health,
yes.
and mental health issues being on the rise. In your view, are we prepared to deal with the mental health issues that will arise out of this, and what do you recommend from your experience as a way to avoid perhaps a follow-on mental health crisis off the back of COVID-19?
Yeah, I think mental health has to be taken very seriously. First of all, not just mental health in these times of the pandemic. There's a lot of fear, a lot of anxiety, and understandably, people will get depressed, right, and very worried. But on top of that as well, there's other factors, in protecting mental health. There's also the risk of stigmatization. People who may have been positive or who have been, related or associated with someone who has a COVID death. So all these things can, complicate and, increase the risk of mental health in communities. And also, we've all been confined. It's not normal for human beings to be staying put in an area for 3-4 weeks at a time, not being able to go out and do their regular, activities. So all these are compounding factors. Is mental health being given enough attention? I think globally mental health is not given enough attention, and this is why I think the first of all is getting people to acknowledge that they may be affected by mental health, and it's okay if they have that, because this is something to be expected. What are the symptoms? What is the first aid that you can do for each other? And providing avenues for them to be able to have someone to talk to get counseling. I think all this needs to ramp up. We are very lucky. We are all from developed countries. We all can have a mobile phone and pick up the phone. We have access to hospitals. But there may be other places where they don't have access to that, and yet they also may be under the same mental pressures as well. And added to that, with the economic impact of COVID, it's going to increase more stress to people, and there will be then an increasing, build-up, or rather there's increasing pressure on mental health.
A question's come in about the use of Bitcoin or cryptocurrency in the humanitarian context. A number of firms in our community have worked with the likes of the Federation around trying to utilize cryptocurrency to get funds where they're most needed. In your experience, has this been limited in use, or do you see this as something for the future that has much more potential in the humanitarian context?
Yeah. Well, I think, first of all, I will say that the humanitarian community writ large is quite averse to testing things that they're not used to, right? So you will hear of the sporadic, cryptocurrency, experiments here and there. UNICEF, I must say, has done a lot of work in establishing a better understanding of cryptocurrency and its applications. We have experimented in a couple of areas, but I don't think it has been as widespread as we would like it to be. But I think beyond cryptocurrency, we also have digital cash, right? Which is as good, if not in many contexts where we need to transfer funds. But I think it's also the blockchain applications, right? The shared ledgers and so forth. And I think one area that I think the humanitarian community needs to look at is how you can actually improve your integrity and accountability using some of these tools, that are out there, the digital and technological tools.
Final audience question before we wrap up. You mentioned the WHO and their role. We've seen in some countries some of the attention, and I would go back to your point about possibly those countries, without naming names, that were late in acknowledging some of the risks, and perhaps their response was not adequate in the early stage. They've certainly started to look at the role of the WHO and perhaps pass some blame. in their handling of the COVID crisis. Can you give us your assessment of, what is the importance of WHO going forward, and an organisation like that? You talked about sort of global collaboration is key, and obviously this would represent one of the key ways to do that. Where do you see the role of the WHO in COVID-19 and beyond?
I think WHO, if it didn't exist today, you'd have to build it. I think it's a really important organization, primarily because of its convening power, its ability to, really collaborate on research, bring out the best practices, the standards, being able to have a global picture of what's going on. One thing I want to remind, everyone is, it's very easy to criticize the UN, and it has a lot of faults, no doubt, but any large institution does. But we must remember, United Nations is a collection of member states. So, WHO as an institution cannot move if the member states are not making the right decisions as well. So, I am very supportive of WHO. I feel that, they have, a very difficult job, right? Even calling for when is it a pandemic, when is it not. You have to time everything because, and all the decisions, it has to use science. And it has to use evidence. It's not about, any intuition or anything like that. So when you don't have enough data, and COVID has been so difficult because, this new data, to collate that data is not as easy. And then, judging your decisions because you do not also want to create a panic, it's not easy. Hindsight is always 20/20, but you go by what evidence you have, and you keep building on that and improving. I think we'll be, we will be in a worse situation if we didn't have an international body like the World Humanitarian Organization.
Dr. Jemilah, I'd really like to thank you for your time. It's been fascinating listening to your unique experience and perspective during these challenging times. I wish you all the best for your efforts in supporting Malaysia's response to the current crisis, and I'm sure we've all taken away something from your views and today's discussion about how we too can mobilise to support more humanitarian causes and crises. I'd like to also thank the GDF and GBBC teams for all their efforts in arranging the Global Leaders Town Hall series. We look forward to welcoming you back to the next webinar hosted by GBBC, which will take place on Tuesday the 5th of May with special guest David Treat, Managing Director and Co-Lead of Accenture's Blockchain Business. Thank you very much, everyone, for listening, and goodbye.
Thank you.